Good evening, and welcome once again to the MIND series, which is a series of presentations regarding ADHD, autism, and learning disabilities. I'm Dr. RyanThompson. I'm the Executive Director of Mind Matters, and with me here today is Susan Deax-Keirns, Marriage and Family Therapist, and Carrina Linblom, Licensed Educational Psychologist. And this is a follow-up to our last episode, which was the identification of ADHD. And tonight what we'd like to do is present some ideas as far as treatment for ADHD, which stands for Attention Deficit Hyperactivity Disorder. And basically what we'd like to do is kind of create a format where we'll present a patient who we are familiar with and talk about the different treatment approaches that might be valuable in treating that individual. So I'd like to back up a little bit and just describe ADHD. Attention Deficit Hyperactivity Disorder has three main components, which are hyperactivity in some individuals, which means too much physical movement or sometimes too much verbal activity, talking too much, and an impulsivity, which means doing things you shouldn't be doing because you haven't thought whether or not you should do them or not. And then finally, inattention, which is the inability to stay on task, to pay attention when you're supposed to be paying attention to, and follow through, be organized on things. So I was thinking of a child that I saw recently. He's about 10 years old, and he attends one of the local elementary schools. And when his parents brought him to me, he was really struggling in school. The teachers had identified him as a child who didn't seem to be working very hard. He appeared to the teachers to be misbehaving and intentionally not doing things he should be doing. And they also noticed whenever he came home from school, his backpack was a mess. Everything was in there in a big clutter. He could never remember his homework. He could never remember to turn in the homework. When he did try to do homework with the parents, he was unable to really stay on it. They had to really stay on him. They had to sit at the table physically with him and then make him do his homework. And as soon as they got up to leave the table, then he was off to doing something else. So, of course, the parents would come down on him, especially Dad, because dads are good about that. They're good about, bringing down the hammer. So they really believed at first that it was really just him being a jerk. The kid wasn't trying, he wasn't obeying, and they just needed to be stronger parents. And so they tried the strong parenting roles, tried to strong arm him, and instead of him getting better, things just seemed to get worse. So things getting worse at home, homework becomes a complete battle. At home, the teacher says he's not trying, he's falling behind in school, he's not reading up to par, and so the parents bring him in to me. And so actually following evaluation by myself and then having them see Carrina, we came up with a diagnosis. He really does have ADHD. Along with that, he has a substantial level of anxiety. The kid he's a wreck. He has his parents coming down on him. He has them hounding him all the time to do things. Every time he turns around, he seems to be getting yelled at because he's forgotten to do something or he's being reminded, he's being punished. And he started to develop a pattern of being dishonest because he's tired of getting in trouble all the time. So then he starts to just automatically say, yes, I did it, even if he hadn't done it. So then he starts getting in trouble for being dishonest. And in school what's happening is the same kind of thing where he seems to be constantly being picked on by the teacher. Teachers constantly saying his name, constantly after him to do things, and then accusing him of not doing what he's supposed to be doing because he's not finishing his test, he's not turning his homework. And the same kind of pattern develops where he just seems like the world is out to get him. It seems like every time he turns around, somebody's there to correct him, somebody's there to catch him, which we really know is that because he's not dialed in, he's not paying attention, so he doesn't see these signals coming. So when I saw the mom and the dad, first thing I saw is that a child who's really struggling in his environment, and that's at home, it's with his family, and it's with his friends. And so I see that he has all these areas that he's struggling with. And so first thing I look at him and I say, okay, how can I help this kid? I have to realize that there's going to be big things that are going to impact him. So if I were to send this child to you, and you're familiar with who he is, what kind of things would you offer the child and the parents?
Well, there's a lot of different interventions that I could see working very successfully with a child like that. The first thing that comes to mind would be something that's really exciting. It's called Neurofeedback, and it's an alternative to medication, and it has long-lasting, permanent results. And so Neurofeedback, in a nutshell, is a brain exercise where the client is hooked up to an EEG, and through their brain waves, they're actually controlling what's happening in this video game that they're playing. And knowing this child that you're talking about, I know that he would love to be able to play a video game, and his parents would be happy to know that he's getting treated at the same time. So I would probably want to start with something like neurofeedback. What happens is that electrodes are placed on his scalp, and we target certain symptoms. So it sounds like with him, we would need to be targeting impulsivity and hyperactivity, inattention, and organizational skills. And so I would come up with a protocol for that particular child, and we would begin training the brain through neurofeedback. So that would be my first place to start, probably with him.
Now, I want to point out that though it's like a video game, it's not a video game.
Right.
A lot of kids with ADHD gravitate towards video gaming, and that actually sometimes seems like evidence to the parents that somehow the child doesn't have ADHD because they're able to focus in on a video game or on the computer or on the television, where in fact that's not the case at all. Kids with ADHD are oftentimes very able to do that, but that's because it's a very intense area of stimulus that they're able to attend to, and so it looks like they don't have ADHD. Studies have actually shown that children who watch too much video gaming or do too much video gaming or watch too much television have an increased risk of both developing ADHD and, if they have ADHD, making it worse. So again, I guess when I hear that, I want to make sure that people understand that from my perspective, I'd be looking at that as an opportunity to say, how much time does your child spend doing video gaming? Sometimes it's temptation for a parent to put the child in front of the video game because the parent's stressed. The parent doesn't know what else to do with the child. They can plug him in front of the TV and they get a little peace and quiet. All of a sudden the kid's sitting still, he's not intruding on things, he's not accidentally breaking things. So if a family is stressed like that, they're looking for opportunities, a little relief. How can they get relief?
Well, that's a good question. So there's a variety of ways to get relief. You know, the most important thing that I say to parents, the first thing is to begin to pay attention to themselves, because they have to learn to take care of themselves. This is a child with ADHD. You know, that's what they do. And so one of the things that you actually always say is the comment, think ADD or think ADHD. You know, when you're thinking, I'm going to, get strangle him. Yes, exactly. You know, because he's 7 years old and he should be behaving as a 7-year-old. Well, he's 7 years old and he has ADHD. So if you can think, behave like you have ADHD, then you realize they are. And so it can give some kind of psychological relief to parents, I find. There's a couple, I take two sort of tacts. So one is to give parents really practical parenting tools. So things like making sure there's a really good schedule and there's good communication, visual cues, and that you have a consistent parenting strategy. There's a lot out there. I'm not attached to any of them, actually. It's helping a parent find one that's going to work for them. So there's that aspect. The other aspect for me, as you guys know, is really helping a parent take care of themselves. So I'm going to give you my favorite quote. We're a world of parents, loving our children and hating ourselves. And so we raise a world of children who grow up loving their children and hating themselves. So if we want to raise a world of children who can grow up loving themselves, paying good attention, accepting themselves as they are, whether they have ADHD or not, we have to start with ourselves. You know, we can't expect a child to be able to stay focused and be obedient and compliant if we're out of control. And oftentimes parents come into my, not oftentimes, almost always, people come into my office because they're out of control. And so really doing that, what I just said, helping them to have some kind of serenity and peace of mind, and some practical tools are the two things that I do. Now, I have a question about this child. Is he emotional? How does he do? Does he break down emotionally?
The child, as long as he's doing something that doesn't require any organization, he doesn't have to be doing chores, doesn't have to be doing something. They talk about sequential tasks where you have to do something followed by something else, followed by something else for it to turn out okay. A child with ADHD does much better in an environment where he doesn't have to be doing anything in any certain order. And in fact, that's one of the treatment things, is where you try to emphasize that they do a lot of exercise and that they do outdoor activities. They've done some really elegant studies showing that children who spend a lot of time out in the open space, like a park or playing around a river or doing something like that, end up doing much better as far as the ADHD and have much better focus following that than they do when they're doing something more structured. They do better than that than after video gaming or after being in an inner city playground or movie theater or anything like that. So really emphasizing that they go out to do those things because they can then accomplish things without having this rigid structure. It actually increases their attentional level. If you force a child with ADHD to do something which makes them anxious, which is oftentimes, okay, I want you to take out the trash, feed the dog, and then go clean your room. They're never going to remember all three things, so it's a setup. And that's what's been happening with this child. He's been expected to be normal, like any other child, and so the parents have these expectations that he should be able to do those three things, and when they give him those three things and he fails, then he's going to get whacked. Not physically, but he's going to get scolded, he's going to get reminded, and each time he needs a reminder, then the parent has to raise their voice up another notch, or they think they do because they think the child's being disobedient. So he ends up being very anxious and, again, just kind of on edge, which then makes him react negatively. So he is feeling anxious. I think he has low self-esteem because he's feeling like he can't accomplish. He's never successful. He's always getting chased after.
So that reminds me of something that you say a lot about. Another thing that I would offer parents is to put yourself in an environment where you're going to be successful. So with a child like this, going hiking, going bike riding with them, not going into, I'm not coming up with an example, but not putting them in a situation where they have to be.
Where you have a lot of stimulus that makes them crazy, or where their hyperactivity, impulsive behavior makes people around them crazy.
Right.
Right. You
Because
don't want
then
to take
it's
them
twofold.
to some group setting where only Grandma Mabel is there,
Right.
who hates kids who move around and squirm.
Exactly.
Have them come in and say hi and then leave.
Yes, go outside and play. Yeah.
Right. Right. Don't set them up to fail.
Don't set them up to fail. And the other thing that I would do with this kid, so I'd work on the parents, because parents come into me believing that it's their fault. Research shows it's not their fault. We can contribute to making it worse, and we don't cause it. And so the next step I would do, I would educate them about ADHD, give them some books to read, especially the dads. And then I would begin to work on the parent, and I would like to work with this kid in concert with Carrina, because I believe in neurofeedback, and especially in attention exercises. And so I would be doing some mindfulness exercises. Mindfulness means breathing. With little kids, it would be taking the 3 deep breaths and exhaling slowly and then smiling meditation, something like that. There's research studies are showing that mindfulness exercises with this population can actually do what you were talking about in the last series, which is help them to be able to focus on what is most important, help them be able to be here in the moment, and help the brain to get stronger. I think neurofeedback does that. Carrina has told you a little bit about that. I think mindfulness breathing exercises, I think being in the body. So things like, being outside in the body, climbing trees, playing in the dirt.
Shooting your brother with a gun,
Right.
things like that.
Right.
Hopefully with just small airsoft BBs.
Right.
Now, once we've identified the child and we're working with a family like that, then there's the biggest part of their life is spent at school. So they have this big chunk at school. So now the parents have identified the child with ADHD. They're reticent to go to the school with the information because they're fearful of the child being labeled. They're not sure that the school would be able to do something different. How would you counsel the parents as far as what should they do now that they know this? How do they integrate that with the school?
Okay, so we do a lot with interagency collaboration, all of us, and one of the important pieces of our job is to connect the clinic with the schools and with the homes so that we're all on the same page in terms of how to help this child be successful across all settings. So the school oftentimes has teams that can form in working with the child to better function within the classroom or out on the playground if they're having social problems. So there's 3 teams in particular that come to mind that I like to encourage families to look into. The first would be a student study team meeting, which would be just basically talking about the child's strengths and weaknesses and identifying what would be beneficial in terms of interventions at school and at home and at the clinic. The school might have ideas for what we could be doing. The next team would be a 504 plan, which is a 504 team that meets and talks about, okay, what do we need to do in the environment at school to be able to foster a positive learning environment for this child so that they're not being nagged or picked on all the time, but they're able to have a lot of successful experiences.
Can you explain what a 504 is? I know that's a number that everybody hears about. What is it?
So Americans with Disabilities Act is a federal law that basically says anybody who has a disability is probably going to require accommodations at school or in the workplace. And so Section 504 is actually the section of that document that talks about accommodations in the school and in the workplace. And so the team meets and talks about what environmental accommodations need to be in place within the school.
What kind of example? What might work for a child?
So for example, maybe they have a lot of excess motor activity where they're just constantly squirming or constantly fidgeting or peeling the paper off of their crayons and chewing off the eraser on their pencil. They might benefit from having a seat cushion, that they're able to kind of move around on. Maybe they need a small stress ball that they're able to squeeze under their desk to get some of that excess activity out. Maybe an accommodation would be before he's asked to sit for a long period of time, maybe 40 minutes of math that he's able to go run a quick errand for the teacher, take a note to the office, or take a run to the fence and back. Also things like maybe he gets a lot of anxiety when he's asked to take a quiz or a test, and accommodation would be that he's allowed to have more time for those kinds of activities. So those would be some of the accommodations. The third team that is something that would be more serious would be if the child was really struggling academically and not making progress in terms of their grade level. We would encourage the family to look into forming what's called an IEP, or an individualized education plan, and that would have accommodations like a 504, but it would then have maybe services. Maybe the child needs counseling at school, or maybe they need an occupational therapist to come and work with them, or maybe if this child has a learning issue, maybe there needs to be a reading goal put into his IEP. And then goals such as time on task, work completion, social skills goals.
And
these
help
kinds
with
of
getting
things.
homework back and forth to home.
Right.
Being familiar with that. 'Cause
Yeah.
homework, I know, is oftentimes a really difficult thing for kids to organize. They may not hear the instruction from the teacher to put something in their backpack. They may get it into their backpack, but then forget to bring it out when they get home because they've forgotten completely about it. They may complete the homework, put it back in their backpack, and then forget to turn it in because they didn't pay attention when the teacher said to turn it in. So those, I know that's something that also the teacher can kind of just give them a little cue and say, by the way, did you bring your homework back? And then they, oh yeah, and then they can pull it out and then they get credit for something at least that they've done. Another thing I usually start with talking with parents first is just seeing what the child's diet is. A lot of kids with ADHD have very poor eating habits. They tend to be erratic in their eating. They tend not to want to sit for a long, leisurely family meal, which also creates a lot of stress because a lot of parents, myself included, really enjoy the ritual of the dinner. And you sit down at the dinner table and everybody shares in dinner and we talk about our day and all that sort of thing. And if you have a child with ADHD and he's done in 5 minutes, or he spills the milk because he's impulsive, or he has to get up to go to the bathroom, which is really an excuse because he needs to get up and move around, or he makes an obnoxious noise during the prayer, which could be something else, could be offensive to somebody, then it disrupts the whole family meal. Along with that, they don't necessarily eat a 3-square meal. So sometimes what you have to look at is targeting ways that you can get healthy foods into them without necessarily having a traditional meal. Breakfast is oftentimes really difficult. Children with ADHD wake up late. They're difficult to get going. They can't get their socks and shoes on, and then the mother or the father's struggling to get them out the door. So oftentimes they'll miss breakfast, or if they do get breakfast, it's something quick. It's like, stuff something in his mouth on the way out the door, I don't care, we're going. So it's a Pop-Tart, it's junk, it's something like that. And they've done some really good studies that have shown that a high-protein breakfast helps with focus at school. And they did one study, it was actually pretty interesting, where one group ate just nothing, and there's another group that ate a sugar beverage or a sweetened beverage, and then one ate high-protein breakfast. The one with high-protein breakfast did the best, and the one that ate nothing did second best, and the one who ate just the carbohydrate meal did the worst. So the Pop-Tart in the mouth actually may be a disservice. So the high-protein breakfast, trying to do something that's easy and quick and that the child will eat, helps their daytime function. So that's one big piece as far as the diet goes. The other thing is avoiding food dyes. They've done a couple of good studies that show at least a healthy chunk of kids who consume food dyes will have worse function during the day. And it's just that day that they have it. And it's not an allergy to the food dye. It just interferes with their brain function. So oftentimes it's a pretty easy thing to test. You do that for a couple of weeks and see if they show improvement with that. Oftentimes we see with a family coming in, I will tell the mother and the father, I think your child has ADHD, and in this case, the child is anxious or depressed. One parent will say, oh, I think you're right. You've really described my child to a T. And the other parent will say, no way. My kid doesn't have ADHD. And yeah, it's oftentimes the father, not always, but oftentimes the father. So automatically you have this problem where you have parents seeing things very different. And so sometimes it's very difficult to arrive to the right place. So if you have two parents who see things very differently, how do we help?
Two parents who see things really differently, how do we help? That's a good question. So I try a couple of things. One is learning to listen to each other. Take a pause, be open-minded. It may just come to differences in opinion, differences in experience, differences in ability to see what's going on. Sometimes it's timing. The mom's with the child all day, so she has a little bit broader perspective. When the dad's with the child, it's often for a fun thing. Often the dads that I see are not the dads. It's the mom who's getting the homework done. The dads are coming home late, tired, want to have dinner, and want their child to sit still. And the mom has been with the child all day, knows that he's, used a lot of energy at school, knows that he's used a lot of energy getting his homework done, and that he needs a little break. So a lot of times it's giving them understanding, but really acknowledging and valuing both opinions. Again, I'm always looking to give someone a tool or a strategy they can tolerate. And so if a mom can tolerate this, do this. And the other thing, you know, my personal opinion, agree with it or don't, is that you actually don't need to agree. That the parents actually could be parenting in a little bit different ways. It makes it easier. So there's a book called 1, 2, 3 Magic, and sometimes I'll offer that as a possible parenting strategy. Oftentimes, a dad.
So they don't have to absolutely agree on the diagnosis to still have
That's
a
right.
similar parenting style or a
Yes.
similar strategy.
Yes, or a strategy that works.
Okay, that makes
Yeah.
sense. What I also know is that sometimes kids, when they are really struggling, sometimes they need more than the basic interventions. Sometimes they do need additional things like supplements, and there are some supplements such as omega-3 fatty acids, which have been shown in multiple studies to improve both mood and attention, and that's something that I offer to parents. And there's some other things that sometimes are valuable, but again, since every child with ADHD is different, they're bringing different things to the table. Sometimes you have to be looking at different things. A lot of kids with ADHD have sleep problems. They can't settle down at night. And so since they can't settle down at night, they don't get good sleep at night, and then they wake up crummy and crabby in the morning. So sometimes improving their sleep can help. Sometimes like a little melatonin or magnesium, which are supplements, can be helpful for that. Ultimately, if they're still struggling, then sometimes medications can be valuable. Nobody wants to put their kid on medications. Nobody wants to. But it's sometimes, again, a choice you're making is saying, if I don't treat my child, then what's going to be the outcome? He's going to fail in school, he'll fail at home, he'll be seen by his peers as being a troublemaker, and he'll see himself as being a failure. So ultimately, they may end up with self-esteem problems, depression, and anxiety if we don't treat with medication. Medication isn't ever the only solution. I also know that children have a lot of problems sometimes with socializations, and sometimes they are seen by other kids as being bad. How do you address that?
Yeah, I hear so much parents saying, my child, is being picked on in the classroom. Oh, Johnny forgot his homework again, Mrs. Johnson, or Johnny did something on the playground that wasn't appropriate. And so, yeah, they struggle socially oftentimes because of their impulsivity and distractibility. And so there's a couple of different things that can help with that we do at the clinic. So we offer social skills training. And social skills training can be in an individual or a group setting. And I just want to remind our audience that today's example is a child, but that we service a lot of adults at our clinic also, and that social skills can be for an adult or for children. Using our example, a child might come to group, like the child we're talking about, and have peers that are there with him, maybe 3 or 4 peers, and they learn about how their behavior affects those around them. They learn that certain behaviors are not appropriate and certain behaviors are very appropriate. So we're reinforcing the positive and then trying to decrease the negative behaviors. And so the second thing would be developing skills such as organization and planning and prioritizing, and really trying to get the child aware of their strengths and weaknesses in terms of organization, and developing skills in terms of being able to develop a system that works for them at school. So I do counseling with them on developing an organizational system. So those would be the 2 things that would come to mind.
Oh, perfect. So I guess in the end, what I want to emphasize is the best way to treat a child with ADHD is to recognize there's no one way of approaching it, that every child is going to be a little bit different. There might be different things that work for different children. So we'd like to just emphasize that that's the best way to approach it. And that's the end of this segment for tonight. What we'd like to do is invite you back for future segments. We'll be addressing autism spectrum disorders and learning disabilities. Thanks for joining us.